Thank you. I'd like to thank the organizers for the kind invitation for this conference here. And it's a pleasure to talk on peripheral vascular disease because it takes me back a few years when I just started off my practice, and a lot of radiologists told me that I don't know why you're going into intervention because there's not much peripheral vascular disease work and you are not going to have many cases. You'll only be doing some biliary works and you'll be pretty bored. But I think awareness is becoming much better in our country, and we do have a high incidence of diabetes, since we all know we are the highest rates of diabetic patients in the world. And still, but I would say PVD is highly underdiagnosed, and I would like to just go through why it is and what we could do to change it. So till recent years, peripheral vascular disease was relatively unimportant disease. There was not much stress on it. But if you analyze data, and sadly there's not too much of it, and especially in India we don't have any data on peripheral vascular disease. If you look at every 100 patients of intermittent claudication, there are around 200 with untreated peripheral vascular disease. And now it is the third most important localization of atherosclerotic disease, and it is an independent predictor of cardiovascular and cerebral events by itself. So what are the risk factors which we have? And male gender, aging, we are having our population lifespan is increasing, so we are going to have more and more elder patients. Family history, we know this, that we have a very poor family history. All the food we eat, the samosas, the vada pavs and all which we have is going to contribute to it. Smoking. It's a sad state that smoking is still not coming down in our country. We do have a lot of smokers. As I mentioned, diabetes, we are the number one. Blood pressure and dyslipidemia. And it's also ladies with an early menopause who have a high risk for peripheral vascular disease. So why does it happen? What causes peripheral vascular disease is, one is the progressive growth of the plaque. There are alteration patterns of the platelet function which can contribute to this progression. And let me be frank with you, is that there are not many people who spend a lot of time taking a detailed history of peripheral vascular disease, especially since the first filter would be in the general practice or physicians. And we don't get accurate history. A lot of it is just diagnosed as leg pain, which is sent for orthopedic. I have a lot of patients who come to me after they've got multiple serial MRIs and X-rays just for spinal problems, as thinking it's a nerve problem, but not diagnosed as peripheral vascular disease. It's a very simple test. You just require to palpate the peripheral vessels, and a very simple, inexpensive test is an ABI, which we will just discuss later. And there are these questionnaires which are available. I do have them if anyone's interested to take it from me. The Edinburgh or the WHO Rose questionnaire, which gives a very detailed questions for diagnosing PVD. So what is the classification? The basic, we all know, I'm not going to stretch much in detail about it. We have stage 1 to stage 4, where stage 3 and 4 comes into chronic critical leg ischemia. We have better classifications now. We have the task classification, which has come modified, task 2, which has just been modified recently. And we can get all these criterias, and we can diagnose peripheral vascular disease and also plan the treatment. Most importantly, what are the signs which we need to look at it? As you can see in this chart which I have made here, is we have in stage 1, you can have all these signs going from paresthesia to pain, and these are the subjective signs, and we have objective signs which we can also assess. So when you have a patient, you can use this chart as a very basic test, and you can diagnose patients of peripheral vascular disease. Investigational findings, I wish we could do all these tests in our patients and give a very objective diagnosis of PVD, but to be honest, the ankle brachial index is one of the best tests which we have. Yes, it can have its criteria where in diabetic patients you may get a false positive or a false negative, but it is a very good test to give a basic diagnosis of peripheral vascular disease and also help in planning your treatment. What is the prevalence of peripheral vascular disease? I apologize to say we don't have any Indian data right now, and maybe we can use this conference as a forum to get Indian data of peripheral vascular disease. But the prevalence, if you look at it worldwide, is obviously it increases over age. You would look at it at patients at 30 years having an incidence of 2 per 1,000 per year, going up to 7 per 1,000 per year. when you reach at the age of 70. So obviously, as the population ages, peripheral vascular disease increases. And the prevalence varies from 0.9 to 22%, and as you can see these slides. But the most important issue is why is it underdiagnosed? One is because majority of the patients are asymptomatic, so they don't come, they don't present, and when they present late. Two, it is majority of them are the older population, and when they are in the older population group, you feel the symptoms are due to old age, like if you have leg pain, or it's because he's old. The other one is the differences of lifestyle. We have more of sedentary lifestyle, so when you do come out to major activity, then only claudication will come through. And the reference of patients to physicians who do diagnose is still much lesser in our country. And as this is what I was just discussing to you about. So there was a study which came as the Partners program, which was done in around in 2000, where it did give us a very good test of the prevalence of PVD and what are the informations it comes. And it was a whole Partners treatment program was done supposed to be done for 10,000 patients, but they managed to enroll around 6,500. And they did select the patients, and they came with very informative data, is that it is detectable on routine practice. So ankle brachial index does have a good role, one. And the most surprising thing is that more patients were aware of their condition than the physicians. So rather than educating patients, our first job is to educate physicians about peripheral vascular disease, that 70% were unaware of PVD in their patients. And obviously, diabetic and smokers did come out as a very good criteria for peripheral vascular disease. And antiplatelets, although the incidence is increasing in our country with more and more patients with coronary problems taking antiplatelets, but the antiplatelets were much lesser, and it has been proved that by the Capri study that if you're taking antiplatelets, it does improve, benefit peripheral vascular disease, and so does the Partner program showed that there was a definite improvement in PVD signs and symptoms on antiplatelets. So what is the natural history? We basically would like to divide it into two. One would be the local outcome and the systemic outcome. So if you look at, there was a study done on 100 patients with intermittent claudication, and if you do correct the glycemic metabolism, 70%, 75 of them will stabilize, 25% will deteriorate, and 2 will land up with major amputation. So 2 out of 100 would land up with major amputation if you don't do anything and treat these patients. The systemic outcome, which is more important, it is proved that peripheral vascular disease is very well correlated with the coronary and the cerebral symptoms. And if of these 100 patients, 5 to 10 do progress to a non-fatal cardiovascular event, there is a 30% mortality. And as you see, cardiac events is 16%, cerebral events is 4%. And there are patients, a good majority of them do not present with cardiovascular events for 5 years. So if you do correct their symptoms, it does give them a good quality of life. And when you look at chronic critical limb ischemia, the data is much more scary, that within 6 months there is a 20% mortality, there is a 35% patients do land up with amputations, and this is exactly what we want to avoid. This is the forum which we have. That's why we have to know why peripheral vascular disease is there, what it can do. We do not want the patients to go into major amputations, because amputations is also associated with a lot of morbidity and mortality. And this is the data which came by the study, which said that failed revascularization on medical therapy, nearly 50% of them progress to very severe outcomes, 20% continue to have CLI, and definitely with the improvement of techniques which we do have in our which are developing, we can definitely revascularize a lot of patients. This data is slightly old. There's not much recent data on epidemiology and natural history. So with the improvements in endovascular techniques, we are seeing much better results, much better limb salvage rates. And I'd like to just conclude by, again, just reiterating the point that PVD is highly underestimated. It is an independent risk factor for cardiovascular as well as cerebral events. So if you do get a patient of PVD, do not just treat the PVD, also check out his, diagnose for his cardiovascular as well as cerebral events. Early detection is mandatory. We want to avoid the worst stage which we have is amputation. Drugs, start the patients on antiplatelets, and prompt endovascular surgeon is very, very important. Thank you so much.